Ahoy and welcome in to another mind expanding episode of Not Allowed to Die, your podcast about mental health, where I, Dan Megler, social worker and life enthusiast, answer your questions about mental health and pull back the curtain on how mental health treatment works. Alongside me, as always, is Mariska, the three-toothed Patterdale Terrier, and you may hear her licking her paws in the background. And it was a bit of a hard day for Mariska because it's very hot outside, and she's a little black dog, and she does not love the heat. And we know the best way to help Mariska with her paws, with everything else, is to rate and review the podcast. So remember, you can follow us on Spotify, Apple Podcasts, and on YouTube. And Mariska wants me to remember to bring attention to the fact that we're doing this in part to promote Pause for Patrick. So if you know a young person with emotional health issues who could benefit from an emotional support animal, please tell them to go to pauseforpatrick.org so we can help connect them to an animal who can be there for them when they need it the most. Now, you know, listeners, that Mariska gets super excited when we have a guest. And she's particularly excited today because we've got Dr. Alex Joannou. He's the creator of the transformational acupuncture system. During his 40-year medical career as a family physician, he's been consulted over 300,000 times and has witnessed firsthand the complex interrelationship between mind, body, and spirit. He's one of Australia's thought leaders in the management of depression and other mental illnesses. So Dr. Joannou, or Dr. Alex, as we're going to call you from this point forward,
Sure.
thank you so much for joining us. Really appreciate it.
Well, thanks for having me on, Dan.
I was wondering if you could tell us a little bit about I'm really, as the listeners of the podcast know, I'm very interested in acupuncture and the way that it can help us in a variety of ways. And a lot of your career hasn't been just about that. But I'm wondering
No.
if you could tell us a little bit about how you discovered the transformational power that acupuncture can have for things like depression and mental illness.
Yes. Well, thanks. It's a long story, but which could fill a few hours talking. But I guess the real focus for me was that I'd been doing acupuncture for about 10 to 15 years when I came across a new method of acupuncture, which was working on the level of the consciousness of the mind through manipulating chakras. I mean, it seems strange to me, but that the Hindu system of chakra energy and the Chinese system of acupuncture have developed in parallel over the last 2,000 or 3,000 years, but there hadn't been any crossover understanding between the two. But the chakras are acupuncture points. Okay. And so therefore you can use acupuncture to manipulate the chakra energy. So I'd gotten involved in that as one side of my mind. And the other side of my mind is I like helping people, the patients that come along to me. So these were people who weren't regular meditators or into mind, body, spirit stuff. They had real problems. And I had one particular patient who's in her 60s with quite widespread osteoarthritis in her hands and in her hips and knees particularly. And her GP, who is also a doctor in our practice, had put her on some opioid painkillers. So, and she didn't like the idea of taking them because of the side effects and addictive nature. So I started giving her this form of acupuncture, which can generally, I found, help pain relief. But the thing was, after, 2 or 3 weeks, she'd got off the opioids and just needed the occasional Panadol. But the thing was, after a couple of months of treating her, she said, "Can I stop my antidepressants?" And I'd say, "Well, tell me about that." And she said she'd been on them for 16 years and she didn't feel like she needed them anymore. And I thought, well, maybe it's just because, she didn't really need to be on it for 16 years and nobody had ever stopped her. But I checked the notes and the other doctor had tried weaning her off the antidepressants the year before. And within a few short weeks, her depression came back again. So I put them back on the medication. So anyway, I was quite ginger about reducing her dose, but we did. And lo and behold, she got off it. And not only didn't the depression return, but she actually started feeling happier and joyful even. And it just so happened that it was around Christmas time. And it came to her attention when some Christmas carolers came to her door and started singing Christmas carols. And she burst into tears. And it was tears of joy and happiness. And she said she hadn't felt that feeling she couldn't remember how long since she had felt that happy and joyous. So, my wife, who's also a doctor, says, look, you've got to start checking this out, see what's going on with your patients. Because I'd had a number of patients telling me how happy they felt and that they were getting on with their spouses better and they were handling problems at work so much better. So then I found half a dozen patients who had diagnosed depression, and I just treated them and monitored them over a year, and they all improved, and to the point of getting off medications, and despite stopping the acupuncture treatment, the depression not returning even like a year or two later.
It's pretty incredible and very exciting.
Oh, absolutely.
What is it about this new method of acupuncture that you found that you feel like delivers more dividends in this mental health space?
Yeah.
What's the difference between so I went once for an acupuncture session just because I was curious about it. What
Yeah.
would you what when you're teaching acupuncturists,
Mhm.
what are you encouraging them to do differently to tap in? Is it a different knowledge of the chakras, or tell me a little bit about that?
Yeah. Well, most of the acupuncture points are just the familiar acupuncture points that acupuncturists already know, so it's not too hard for them to pick it up. But it's the combination of the needle points, using sacred geometry to form patterns with the needling,
Mm-hmm.
seems to give the total pattern more power than you would expect from the choice of individual needles. Um, I don't know if it's because it's stimulating certain areas of the brain, and the fact that you put the needles in a particular order, you're stimulating one part of the brain, and then you stimulate another part of the brain, and it's usually on the left-right basis. And it just I've taught in Australia now about 30 odd acupuncturists this method, and it's like and I did it in a workshop setting so that they actually experienced treating each other,
Mm-hmm.
and it's like they start the workshop like on a Friday afternoon, and they're all sort of feeling pretty dead from a busy week, and then they think, oh no, we got a 2.5 day workshop ahead of us, but by the end of the workshop they're really buzzing and excited and feeling energized, and can't stop talking about how it felt, because I don't know, it seems to be a more powerful treatment. And certainly, even from the very first treatment, a lot of patients will feel the shift in their mental state starting to happen.
Well, it sounds like it's unlocking something from an energy standpoint. And we
Mm,
know that often, one of the most common symptoms of depression is an absence of energy. And in talking to you before, you pointed out that medication can't cure depression, it can only reduce some of the symptoms.
yeah.
And so, what have you found that in acupuncture, in a way, is helping people to tap into more of a positive energy?
Yeah, yes. I mean, the whole system of medical training, doctors are trained to look for symptoms and
Hmm.
signs to treat disease. But, the World Health Organization's definition of health is that it's a state of complete physical, mental, and social well being, not merely the absence of disease or infirmity. It's a big statement, and there's probably not too many people in the world who are in a state of complete physical, mental, and social well-being. But it's possible, and if you're in that state, you are in a happy state. But the doctors are trained to look for disease, really, and treat depression like a disease, but it's not a disease. They call it a disorder, a lack of order in the mind, as are all mental illnesses. So, doctors with medications too, you're just trying to reduce the level of depression. But and so if your level of depression is reduced, then the doctor's happy
Hmm.
that he's achieved his task. But it doesn't mean that the person is feeling happy.
Well, and not only
And
that, but so many doctors, in particularly in the United States, they poo-poo when I'll have clients will say, "Well, I'm gaining weight, I'm having a lack
mm,
of libido, I'm having
yes,
these other serious side effects." But the doc,
yes,
if I, the doctor says, "But you don't want to kill yourself anymore," and that
mm,
feels adequate. And unfortunately,
yeah,
particularly in the U.S., and I don't know how it is in Australia, there is no, like, the model is set up that people only get compensated if there's a problem and insurance can
yes,
identify it and they
totally,
can reduce it. And
yeah,
but there isn't much for the way of positive health and people doing things
yes,
to promote, exercise and healthy
Absolutely.
things like that.
Yes.
Now, in
Totally.
Australia, is it any different? Are people able to get coverage for getting things like acupuncture unless
Well,
there's a disorder or?
yeah. Well, under the Medicare system in Australia, Australians are entitled to get a rebate for acupuncture if it's performed by a doctor.
Okay.
And also, like chiropractors and so forth are included in that sort of system. So, yeah, it makes my life easier as a doctor. And also the fact that I am a doctor, I say to patients, look, they've known me for years, and so they've built up a trust. And I say, well, just try it and see. There you go. So it's not so scary or threatening when I'm offering it to them.
How did you get your original interest in sort of more this Eastern, whether it's acupuncture or chakras and things like that? Where did you first get exposed to that?
Yeah. Well, just like a lot of doctors, it was through my own health problems.
Okay.
Up till the age of in my mid-30s, I was just Western trained, and that was my thinking, and I thought medicine had a complete understanding of the body. And then I happened to develop Crohn's disease, which is, for those of you who don't know, is quite a nasty bowel condition. I was working hard at the time, and I thought my tummy upsets and pain and lack of energy was all just due to being overworked, which I was at the time. I was seeing 250 patients plus a week, which is pretty insane.
Yeah.
But the thing was, I ended up having to have antibiotics for a week and then surgery, and they cut out a couple of feet of my intestine. And I talked to the surgeon afterwards. It took some time to recover, of course, but and I'd lost 15 kilos in the process, and I'm not a big person. And he said, I said, like, what sort of diet should I follow? It seemed a logical question to me, and he said, oh, you're cured. Eat anything you like. And I go, oh, really? And he says, yeah. So I did, but then within 6 weeks, I started getting symptoms again. So that started sort of undermining my faith in the medical system to know everything. And fortunately, a friend of mine was into mega doses of vitamins and diets and all this strange stuff. It seemed to be strange stuff at the time. This was in the mid-90s. And he put me on mega doses of vitamins and got me on a gluten-free, dairy-free, wheat-free, meat-free, nut-free diet, which was really restrictive. But the thing is, my symptoms disappeared and I started getting better, a whole lot better. And then I did get a recurrence a year later. So I was feeling disillusioned and disappointed then. And a friend of mine said to see a friend of hers who was a shiatsu therapist. And I'm going like, what's a shiatsu therapist? But literally in the space of one treatment, the mass that was forming in my abdomen disappeared in the hour's treatment.
Oh.
And I'm saying this is remarkable. And I'd seen a specialist the day before and had further tests which confirmed the Crohn's disease had come back in full force and started me on steroids. But I'd literally only had one tablet of prednisone before the treatment. And I talked to the specialist a week later, and he's saying, oh, prednisone's marvelous stuff. And I said, well, look, I only had one tablet. And then I went to this therapist, but he wasn't interested in that therapist. But that really sparked my whole interest in the concepts of Chinese medicine. And around that time, I got involved in interest in a Touch for Health course, which uses kinesiology techniques. So that opened my mind further to, okay, there's other ways of looking at the body than the traditional Western approach. And then there was some doctors who were formed an acupuncture society in Australia, put on a half-day workshop, and I attended it. And I thought this was just mind-blowing, the fact that the Chinese have worked out stuff, hundreds, a couple of thousand years ago, and they'd developed a whole system of medicine based on their view of the body, which is looking at it from a functional viewpoint rather than from a organ-based viewpoint. And it just really blew my mind. And I just, from this half-day workshop, just tried putting in a couple of needles into patients. And lo and behold, they said they felt better. And I thought they were just humouring me at first, but they kept coming back and asking if I could treat this or whether I could treat that. So that spurred me into learning more and more. And yeah, I haven't looked back since. Initially, I was offering acupuncture as a last resort, people who couldn't tolerate drugs. This was mainly for chronic pain and not, feeling really disillusioned and downhearted about the whole thing. And the acupuncture was improving them. But it wasn't until a few years later when I had that patient with the 16-year depression that it twigged that there's something really powerful going on here.
I think, the people like you who started out as skeptics, they are the most credible often because your story comes from a place where you weren't just necessarily believing this and you actually had the medical training and you'd seen all these other things.
Yes.
What do you think, our current system is so entrenched in not wanting to give things like acupuncture a chance and call it woo-woo. What do you think the big pushback is from so many people who are closed to the idea of what this could be doing for people?
Well, I've tried doing my part by writing a book called Stick It to Depression, Another Tool in Your Doctor's Bag. And I've written it specifically for the general practitioners and family physicians to read it, because I detail my journey from Western medicine through to understanding all these other aspects of viewing the body, as well as detailing cases and sort of trying to explain where medicine's sort of going off the rails with the way we try to treat depression, particularly. I mean, just one little study I mentioned is that if a patient goes into the doctors saying, I'm depressed, if they mention a drug by name, like a friend of mine suggested I try Prozac or whatever the favorite brand at the time is, they're 17 times more likely to get a script for that drug than if they don't mention drug therapy at all.
That's interesting. But again, if they go in and they mention acupuncture, I wonder what their doctor will say.
Yeah. Well, at least around the town I'm in, there's about 80 doctors, and a fair percentage of them are referring their patients to me now for treatment of depression.
And I think that's great and I think that's partially probably because you've earned that trust. You have a reputation and whatnot.
Yes.
And I think particularly in the United States, we have such a psychopharmacological model. And unfortunately, psychiatrists and the people who we're going to for the treatment of depression, so often if a person says, well, I don't want any medication, then they're like, well, then there's really nothing I can do for you.
Yes.
And so it feels like people are stuck. And I think when I talk to people who are starting medication, I'll say, for the people I work with, and this is just anecdotally, 50% of the people I work with, the first medication they try does not turn out to be a good fit for them.
Yes.
And I think for people who try other things, if they try exercise, if they try diet change, if they try acupuncture, there's a chance that won't work for you. But isn't it worth investigating? Because there's a chance that it will work for you with significantly less side effects.
And that's right. And the thing is, a lot of people have viewed acupuncture as an alternative therapy, but it doesn't have to be an alternative. It can be an adjunct. As in you can add it on to counseling or drug therapy, and it doesn't interfere with what's happening there. So I'm not asking people to say, stop your drugs, come and try acupuncture by any stretch of the imagination.
Right. It's both and then let's figure out what actually works for you as an individual and what's going to help you more long-term. Now, for the people who you're working with who are specifically trying to use acupuncture for depression or another mental health condition, you said they don't necessarily need to have this weekly for the rest of their life. So what has what in your experience, about how long is it typically before people are seeing lasting help and benefit from the acupuncture?
Well, literally 8 treatments over 8 weeks. Most people, they're either dramatically better or feeling the improvement. And it's sort of like, you mentioned stuck. It's a good word for depression. People do feel stuck, and this is about unsticking things. Like you put the needle in, and it helps unblock whatever the blockage in the energy is, so that energy flows. And when that starts to happen, people start actually, bursting into tears or letting off steam. By often within 24, 48 hours, they'll have a big argument over something trivial, but it's because things have been pent up and blocked for so long. So once people start getting that sort of response, they're really shifting. People will often feel calm, even from the very first treatment. They'll walk out feeling calmer and lighter. And, I've had, like one patient said that who had depression for 18 months following a head injury, and that she found herself singing in the car on the way home from the first treatment. And she said she couldn't remember how long it was that she had sung out aloud, because she said she used to like singing, but that had just suddenly spontaneously came to her. And once you get that kind of shift, that often results in a real permanent sort of change in people.
Are there any people that you would say should not consider acupuncture who are dealing with
Mm.
anxiety and depression? Or like, because it doesn't sound like there's any negative side effects from it.
Yeah,
Or is there anybody that you
yeah,
would say, yeah, definitely, maybe horrible hemophilia, or I don't know. Is there anybody that you would
yeah.
say
Well,
you should not
yeah,
consider?
not really. I always say to patients, whatever their problem is, I give that as an option, especially situations where medicine doesn't have a clear answer that this is the treatment for it, standard
Mhm,
treatment. I say, why don't you give acupuncture a go?
mhm,
If you don't like it, I'll take the needle out, the first needle, if you don't like it. But most people, once you put a needle in, they go, "Oh, is that all there is to it?"
mhm.
And by the end of the first treatment, most people are convinced that it's shifted something. They can feel something happening that's quite unexpected for them.
Other than a fear of needles, are there any other
Mm.
things like misconceptions that seem to be holding people back from, like when you talk to people about it, that that they are misunderstanding about
Mm.
acupuncture and how it works, that you're having to, like,
Yeah, yeah,
that you have to overcome to get people to give it a try?
yeah. It's just most people, well, not most people, a fair percentage of people just can't believe that just sticking a needle just under the skin is going to do anything, and just sort of laugh it off. And I say, just try it and see. I've had there was one woman in the mid 80s, and she'd had throat cancer and had to have major surgery and radiotherapy, and she was really getting down, the sort of burning pain in the throat all the time. And she had this was another patient in the practice of another doctor, and she was put on steroids and put on narcotic opioid painkillers, as well as in the end antidepressants to try and help her. And I'd known her for years, and I'd just seen her in the waiting room on a number of occasions and say, just try the acupuncture, why don't you, please?
Mhm.
Can't do anything make situation worse. And she was quite firm in her belief in the Western system, but in the end, it was getting her so down that she felt like she was losing it, because she was caring for her husband, who was many years older than her, with dementia, and she just couldn't cope. And so I said, look, just let me give you one treatment and see what you think. And if you're up for it, 8 treatments over the next 8 weeks. And she says, okay, but that's it. No more than that. I said, no more than that. Okay, let's try it. And at the end of the 8 weeks, she says, I can't believe it. I just can't believe that it's actually worked. She was off the antidepressants, off the painkillers, and just actually felt and looked like she was more in control of her life, and happily organising a husband and so on and so forth, and back to her usual jovial self. So, and I've talked to her since, and she's still amazed by that hasn't got any understanding of how the needles could possibly work. But
Yeah.
that's fine. I say that you don't need to know.
Well, it's when I first heard about EMDR therapy for
Yeah.
post-traumatic stress disorder, I don't necessarily understand how the eye motions
Mm.
make that post-traumatic stress disorder work, but I know it's
Mm.
very well researched and I know it's working. So, as I
Yes.
say, I don't need to understand everything about the mechanism. And we,
Mm.
as even in the Western scientific community, our understanding of
Yeah.
the brain is infinitesimally small. I think 30 to 40 years from now, they're going to look back at what we're doing today for the treatment of depression, and it's going to be like when we were treating people with leeches or for the
Yeah.
different
Yes.
humors. And
Yes.
it's embarrassing the degree to which we are
Yeah.
just throwing things at people and hoping that they're going to
Mm.
stick and work.
Yeah. Yeah.
Now, how about for like anxiety? Is acupuncture also shown benefits for people with
Oh, yeah.
anxiety?
Absolutely. Yes. Definitely. I mean, often the anxiety settles down quicker than the depression improves, because I mean they're separate conditions, but a fair percentage of people with depression are also anxious.
Hmm.
So even just relieving that anxiety, which can happen even from the first treatment, they can feel that shift and calmness coming over them. Then you're on a winner as far as giving them treatment's concerned.
How about is there any
I've
special
used
things?
it for.
Oh, go ahead.
I was going to say I've used it with patients with post-traumatic stress disorder as well, with good results. I mean, generally it's a longer process. I mean, if you just had depression because you had a split up with a partner and
Mhm.
happened a couple of months ago or something, that's a relatively short-based thing. But yeah, I've had, well, thinking particularly of one woman who was in her late 30s, and she had had lots of issues of depression, and through counselling it came out that she had been sexually abused by her father as a girl. So I was working on her for about 2 or 3 years, but in that time uh, she uh, she ended up going to the police, giving statements, and the police were very sympathetic to her story, and actually then charged her father, and it brought down the whole family against her because the wife of her mother and her sister were dead against this and said that this was not something to talk about and it wasn't true and all of that. And he ended up going to jail for a few years in the end, so because he was convicted. And she said she would never have been able to cope if she wasn't having the acupuncture, but it just helped keep her together during that time.
Well, I was talking to one of my clients who's a trauma survivor, and
Mm.
it's so difficult sometimes to even begin to open up and process the trauma in therapy. And sometimes we need
Mm.
those other, as you're saying, things that are working together with the therapy to help
Yes.
reduce your stress so that you're more able to open up, so that you're less afraid that because our stress can be
Yeah.
like a wastebasket that's filling up. And if whether
Yeah.
it's the acupuncture that can help or other means that can help, that can actually aid that person in their
Mm.
counseling
Mm.
sessions, because if I'm coming into my counseling session a little safer, a little more calm, a little less stressed,
Yes.
I might be able to open up and reveal those kind
Yeah,
of things like the one you're
absolutely.
talking about.
Yeah, yeah. So it works well with counselling because often during the acupuncture itself, it brings up issues. People will see things in a different light, like a third person perspective of themselves. Um, if I can relate my own
Mhm.
experience, which is the first time I had this form of acupuncture on me, and I thought, wow, this is mind blowing. Was within 5 minutes of the treatment starting, I literally felt like I was flying. I could feel these 6 foot wings flapping
Wow.
away, and I could see like a countryside down below, a couple hundred feet below me, and then I saw a whole bunch of people there, and then I saw a couple of people who had been hurt me severely in my life through marriage difficulties, and it was really painful for me. It had been some years before, but I'd worked very hard on understanding forgiveness and being able to forgive. But the thing was, when I had the treatment, it's like uh, I saw those people in a different light. I saw that what they were doing, any hurt to me was a byproduct of their drama. And as soon as I recognized that, the thought came to my mind. It was like I could literally feel my heart open up, and this flood of compassion came out of my heart, love and compassion and forgiveness for these people for what happened. And the next moment, I saw myself down below, and I realized I could see that I was just a regular human being who is equally fallible and not the perfectionist that I had always seen myself as being. I wasn't that perfect. And as soon as that thought came to my mind, again, my heart opened up with flood and compassion for myself, and a feeling of love and forgiveness for the things that I've done wrong. And as soon as that feeling from that treatment has never left me. It permanently changed the way I look at patients when they come in with their problems, and that it's just huge shift that you couldn't possibly believe that just sticking a few needles in the skin would do that.
Well, but I mean, in my experience, people who are able to let go of chronic recurrent
Mm.
depression, it's almost
Mm.
invariably because there's been some life event that's shifted their
Mm.
perspective. And
Yes.
now more and more they're opening up research on psilocybin. They're opening up research on ketamine.
Yes.
They're opening up
Absolutely.
research on transcranial magnetic stimulation. And I'm interested in
Yeah.
all these things. But
Mm.
what I want the audience to hear right now is acupuncture might be another way, another
Yes.
chance. You're just giving yourself a chance to see life through a new perspective. And it
Yeah.
might not happen for you, but if it gives you that
Mm.
shift, what a small investment for what a potentially
Yes.
large,
Totally.
and for those people who are saying, yeah, I want that new perspective, but I'm nervous to try psilocybin. Okay, there might be
Mm.
some good reasons
Mm.
for you to be nervous about that.
Yeah.
So we're talking about a lower side effect threshold.
Yeah. I mean, the number of I keep track of these things in medical journals over the years, and there was a case of a poorly trained acupuncturist who I think it was a chiropractor that had needled and punctured both lungs in a
Oh
patient.
my
The
God.
patient unfortunately died, but that's just incredibly poor technique, and and you know, and that's just like one case in how many years. I
Hmm.
mean, I've even treated lots of people who are on warfarin for because of they need their blood thinned, and yet they don't bleed after the needle.
Yeah,
When
because
you
it's such
take
a
the needle
tiny
out.
needle. It's very,
Mm,
very small.
yeah.
Now, what should people, if people are looking for a quality acupuncturist, is there anything
Mm,
particular that you would say, if you're doing your research on the person who you're thinking about going to, is there
yeah.
anything that would be a green flag, like head toward people like this, or a red flag, like stay
Yeah.
away from people who are
Yeah.
doing this?
Well, in America, they're generally called licensed
Hmm.
acupuncturists.
Okay.
In Australia, it's a registered acupuncturist. So there's lots of people who call themselves acupuncturists who haven't actually officially learned all the techniques and of doing acupuncture.
So,
So
so
licensed for one
make
thing.
sure they have their
Yeah,
proper accreditation and that they're
yeah,
licensed
yeah.
is a
But
starting point.
and the people I'm training now, I'm certifying them as transformational acupuncture practitioners, and on my website, stickittodepression.com, they're listed there. I haven't got anybody from the States yet, but I've just trained my first bunch of Canadian acupuncturists,
Okay.
and I'm just hoping anybody out there who's either an acupuncturist or knows an acupuncturist will send them to my website to check me out. And because it's an easy technique for acupuncturists to pick up, but I teach it in a safe way so that I teach them how to speak the lingo of doctors so that doctors can understand what they're doing and vice versa. And because acupuncturists tend to sit in their own world and talk, Chinese medical terms, which a Western doctor thinks is a load of rubbish.
Yeah.
So I teach them how to communicate and how to rate people's depression and recognize the red flags when things are going wrong and that sort of thing to make it safe.
You spoke about the book before. Is the book
Mm.
written more for people who are practitioners, or is it written for people who might be absorbing it as as a client, or who is
Yeah, well, I'm glad you asked because I've written two books
okay?
and they're both called Stick It to Depression. But one is subtitled Another Tool in Your Doctor's Bag, which I've
Mhm.
written for doctors.
Okay.
And the other one is Get Your Life Back Naturally, which is written for the general public.
Okay.
So it's very similar content, but just written in a different way and the emphasis is different. So they're both available on Amazon and on my website.
Okay. And I'll put a link to that in the show notes
Yeah,
too.
yeah. Thanks.
One more population, I guess I wanted to ask you about it. A population that I've talked about on my program before is pregnant women.
Right.
Because a lot of times they are trying to be weaning off of different kinds of
Mm.
medications. So, is there any contraindications for pregnant women for using
No,
acupuncture?
no, acupuncture is very safe.
Hmm.
The traditional Chinese masters from ancient times said there were certain points that were forbidden to be used in pregnancy,
Hmm.
but that's only a handful of points out of the 360 odd points
Hmm.
involved. And but a recent study is actually they were deliberately needled people, pregnant women with those points, and they didn't pick up that there was any issues. So they haven't found any contraindication.
Well, and I think there's a lot of recent research that's saying babies can pick up on the stress of the mother, and that can have
Absolutely.
long-term health effects. So, how
Yes.
much more? I think one of the things, again, if, for those of you who are listening, we want to think not just about symptom reduction, but also what are we doing everything we can to be as healthy as we can and as positive as we
Yeah.
can. So if you're a person who is considering this, and especially if you are dealing with pregnancy and all the hormonal changes and everything that goes with that,
Yeah.
you would take those prenatal vitamins, you would do all those other things. Let's make sure we're doing everything we can to not just reduce your stress, but like where I work out, I often see pregnant women coming and working out, and I think that's great because we need to keep those endorphins coming in all the
Yeah,
different ways that we
absolutely.
possibly can.
Yes.
How about for
Yeah,
age? Oh, sorry.
trading two for the price of one.
Yeah, exactly right. They're coming into this world with a little bit more calm. How about
Yeah.
like ages? What's the youngest person you've ever done acupuncture on?
6 weeks.
Oh my God, really?
Yeah, that was for colic.
Okay, so just
The mother
really
was
couldn't
getting
stop
quite
crying.
distressed, and the pediatrician said, that it was just colic, and the baby would grow out of it, and everything would be all right in the end. But she wasn't happy with that because she's got this baby that was crying a lot of the time. And I always use laser acupuncture in this case because using a laser light rather than needles.
Okay.
And literally a 5 milliwatts, which is a very, very low powered laser, and on points for just literally 10 seconds each, and treating the appropriate points. The baby stopped crying while I was doing the acupuncture. She came back 3 or 4 times after that, and the baby was fine. And I met the father in the street months later and said how well the baby was going, and that they couldn't believe how well the acupuncture had worked. And they said they didn't know what they would have done if the acupuncture hadn't have worked. So, that's the youngest.
Yeah, well, I mean, there's nothing more stressful than watching your crying child and not being able to help them. And I think,
Yeah.
so if you can give that's something I hadn't even considered would be a possibility. How about any age range, the oldest client that you've worked with, or?
Well, actually, the oldest one I know of is one of my Canadian acupuncturists. After the very first workshop, because I run it as a series of 8 workshops over 8 weeks, the next day she tried it on a 94-year-old who had chronic pain for 20 years and insomnia as a result of the pain. And she gave her the treatment I recommended that I teach everybody to use to start with as a baseline treatment. And she rang the acupuncturist the next day excitedly saying she was free of pain for the first time in 20 years, and she slept all night. And subsequent to that, she's had further treatments and is doing amazingly well. So 94.
Wow,
We could try for older.
Well, again, to me, and those who are listening can tell, I am obviously an enthusiast for this. I hope this is something that people will explore. Is there any other message that you want to get out to the people who are listening about just whether it's about acupuncture or just mental health and just overall health in general?
Well, it's just not to lose hope. There are ways and techniques, and people can come into your life. There are things you can do yourself, even if you are on drugs or not. Like, as you mentioned, just a daily walk, even walking first thing in the morning, just set that target to get out of bed. Often you just feel like, oh, I don't really want to get out of bed, which is a common situation with depression. But once you do, I think once you get back from the walk, you don't regret it. It's not like you say, oh, that was a waste of time.
Yeah.
Everybody feels better. And paying attention to diet, particularly, which, in this Western world of fast foods and so on, we don't really appreciate that fast foods, well, one, they're quite addictive, and two, they actually have been shown to worsen depression symptoms. And I think it's, because there's the various oils that are used in the cooking and the heaps of sugar and so on, it has inflammatory effects on the brain, I think. So even changing diet can start turning that around. And it's often when you're depressed and you crave certain foods, it's often the foods that you crave are the worst offenders, unfortunately. It's like your body's addicted to the stuff.
I was talking to one of my clients today who has a problem with binging foods, and so often it's those foods that we are craving and binging. They give us those quick pops of the sugars and the carbohydrates and things like that. But it's because we need to find another way to get those needs met, to scratch that itch, a way that's more healthy and sustainable. And so, okay. Well, so you said again, your website is stickittodepression.com.
Yep.
Okay. And checking out the books there.
Yeah,
And
yeah, and if they just click on the button that says "Start Here," and then they can get onto my mailing list, and I'll email them back and have a chat with them about their specific situation.
well, Dr. Alex, thank you so much for the time that you spent with us. I'm like very encouraged and excited about what you're
Great.
representing. And I just hope, please keep me informed if there start being practitioners in the United States
Yeah,
who are
yeah,
really gotten your
for
method,
sure.
and I'll spread that out to people. And
Great,
so,
excellent.
so for everybody who's listening, remember, do whatever it takes to get you through this world. And until we speak again, you are just not allowed to die.